Welcome to the Dental Podcast. Today, we are diving into a topic that, honestly, it sounds a little cinematic, but it could be happening inside your mouth right now. We're talking about the hidden threat of oral parasites and their really critical link to aggressive gum disease.
And our mission today is to cut through all the complex research and just distill it into actionable knowledge for you because, we all know about plaque and bacteria. But these findings about specific organisms, Entamoeba gingivalis and Trichomonas tenax, they really change the game for how we should think about preventing and treating severe gum disease.
That shift in perspective is so important.
Mm.
And the insights we're unpacking today, they come from research that's being contextualized by care providers like the team at Dental and MedSpa. We're really moving past just, basic cavities.
Way past that, into the microscopic world that drives chronic inflammation.
Okay, let's unpack this then. When we think of oral health, our minds go to bacteria. So what exactly defines an oral parasite here, and why is this distinction so important for our dental health?
Right. So oral parasites are single-celled organisms, or protozoans, that live in the mouth. But unlike bacteria that just sort of form colonies on surfaces, these parasites are often mobile. They're aggressive.
So they're actually moving around.
Exactly. They actively hunt for nutrients and shelter, and their presence directly causes gum inflammation and, pretty serious tissue damage. They aren't just a side effect of an infection, they are active drivers of the disease.
And when we talk specifics, we're really looking at two main culprits, right?
That's right. The primary ones linked to advanced periodontal disease are Entamoeba gingivalis and Trichomonas tenax. Just their presence alone completely upsets the healthy bacterial balance in your mouth.
So if they're moving around looking for food, how do they get there in the first place? And what kind of environment are they looking for?
They absolutely love anaerobic spots. So low oxygen pockets that are created by, compromised oral hygiene. They often get into the mouth through contaminated food or even water, but they only really take hold and multiply when there's existing plaque and inflammation for them to feed on.
Okay, so a poorly maintained mouth is like rolling out the welcome mat for them.
It's the perfect breeding ground. The moment the environment is right, they multiply, and that is when the real trouble starts.
And here's where it gets, frankly, a little horrifying. How do these tiny organisms translate into huge issues like chronic periodontitis, which can, lead to losing your teeth?
This is really the scientific core of the whole issue. It's all about how they trigger our immune system, or, more accurately, how they trick it.
I get that the body reacts with inflammation, but what's the actual mechanism? It's not just general irritation, is it?
No, it's so much more clever than that. Entamoeba gingivalis doesn't just irritate the gum tissue, it actively eats our body's first responders, the immune cells called neutrophils and macrophages. It literally consumes our defense force.
Wait, hold on. So the parasite is eating the very cells our body sends to kill it?
Precisely. It's essentially disarming our defenses right at the source of the infection.
That's incredible. So it just lets the inflammation run wild.
It sustains it. This constant consumption of immune cells fuels a chronic, very intense inflammatory response. And that chronic inflammation is incredibly destructive. It leads to the irreversible destruction of gum tissue and, this is the critical part, the underlying bone that holds your teeth in place.
So that's how the pockets form and the gums recede.
Exactly. When that bone structure weakens, you get deep pockets, gum recession, and ultimately you can lose your teeth.
We saw an article in Infection Control today that really hammered this home. It mentioned a really alarming statistic.
It did. That piece highlighted that in cases of advanced periodontitis, E. gingivalis is found in something like 90% of samples.
90%? Wow.
Yeah. So that suggests it's not just some secondary bug that shows up late. It's a central driving factor in the most aggressive forms of the disease.
So if these things are driving a war in our mouths, the question becomes, how do we fight back?
Yeah.
What can we actually do to combat this specific microscopic threat?
The focus has to be on prevention, but with, let's say, an elevated sense of diligence. We have to target the conditions these things love. So brushing and flossing are the foundation, of course, but we should also think about things like antibacterial or even antiparasitic mouthwashes and specialized cleanings that can disrupt those deep, low-oxygen pockets where they hide.
This sounds like it goes way beyond just what you can do at home in your bathroom.
Oh, absolutely. Routine dental visits are just non-negotiable here for two reasons. One, for the specialized deep cleaning that gets below the gum line where you can't reach, and two, for early detection. A professional can spot and treat periodontal disease before it creates that perfect sanctuary for these parasites.
Let's talk about lifestyle for a minute. We know diet helps the immune system, but Are there specific nutritional things we can do against a parasitic threat?
A balanced diet is always your first line of defense, but
Hmm.
for gum health specifically, vitamin C is huge. It helps produce collagen, which keeps your gum tissue tight and strong. It literally makes it harder for them to invade.
A stronger wall, basically.
Exactly. And don't forget, just simple hydration. Saliva is your body's natural mouthwash. It neutralizes acids and flushes away the debris that these parasites feed on.
Okay, so what about the bad habits? What are the things we do that basically invite these parasites in?
Well, there are some major risk factors. Smoking and excessive alcohol are big ones. They weaken your immune system across the board, and locally in your mouth, they cause dryness.
Draining the moat, like you said.
Right, you lose that protective flow of saliva. And another huge one is stress.
Stress. How does stress factor into a microscopic infection in your gums?
It's a massive problem. High stress weakens your immune response, so your body is less effective at fighting the invasion. Plus, what do people do when they're stressed? They often clench their jaw or grind their teeth, sometimes without even knowing it. That causes tiny traumas to the gums and bone, opening the door for infection.
This all really highlights how connected everything is. Which brings us to the source of this deep dive, Omnidental and MedSpa. Let's just briefly talk about who they are and the kind of care they provide for these complex issues.
Of course. Omni Dental and MedSpa is located at 305E Rand Road in Arlington Heights, Illinois. It's led by Dr. Billis Poles, who has over a decade of experience in general, cosmetic, and especially advanced preventive dentistry.
And what's their philosophy when it comes to patient care?
Their entire practice is really built on trust and personalized attention. They treat everyone, from little kids to seniors, like they're part of the family. They get that these complex oral health issues have to be looked at as part of a person's overall health.
So for these advanced gum issues we've been talking about, what specific services do they have that would directly fight this parasite and inflammation cycle?
They offer a whole suite of advanced care, things like gum disease laser therapy, which is a very precise way to treat inflammation, and deep teeth cleaning, which is essential for breaking up the parasite's hiding spots. And then for cases where tooth loss has already happened, they handle complex restorations, like dental implants, even full arch and all-in-four systems.
And I see the MedSpa part of their name. That points to a more holistic approach, right? Connecting health and aesthetics.
That's the integration. They recognize that things like stress and your systemic health directly impact your oral wellness, so they integrate advanced aesthetic and wellness services, things like injectables or IV drip therapy, right alongside their core dental work. It's a one-stop shop for comprehensive care.
And for our listeners who are in the area, the NW Chicago suburbs, where can they find them?
Omnidental and MedSpa serve the communities all around Arlington Heights. So Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, and Elk Grove Village. The number to reach them is 847-483-8833.
Okay, so to wrap up this deep dive, the main takeaway for me is that oral parasites like Entamoeba gingivalis aren't just some theoretical curiosity. They are a real hidden threat that uses a pretty sophisticated method to destroy bone. And it just proves why proactive, comprehensive dental care is absolutely non-negotiable.
And I'll leave you with a final thought to chew on. Given that we know high stress and a weakened immune system are major factors in these parasite-related diseases, shouldn't assessing a patient's sleep habits or their overall stress load become just as standard as measuring gum pocket depths during a checkup? The mouth is truly a window into the body's bigger battles.
That is a profound point. A lot to think about there. If you are in the NW Chicago suburbs and want to ensure you're getting that kind of comprehensive care, schedule your appointment at Omni Dental. Thanks for diving deep with us.